Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, everything you need to know about a broken nose. A broken nose, also known as a nasal bone fracture, can cause swelling, bruising, and pain. A nasal fracture occurs when bones or cartilage in the nose crack or break during sports, accidents, or physical altercations. Blunt trauma accounts for 9 out of 10 broken noses. /r/n/r/n Because the nose protrudes from the surface of the face, it's often the first area to experience impact. The nasal bone is one of the most frequently broken bones in the human body. Nasal fractures account for over 50% of all facial fractures in adults. Recognizing the symptoms of a broken nose can help ensure you receive appropriate treatment. /r/n/r/nNes, Getty Imagesrnrn Below are some telltale signs of a broken nose. /r/n/r/n Although these are common signs of a broken nose, it's possible to have swelling and bloody nose without actually breaking your nose. /r/n/r/n Contact a healthcare provider if your nasal trauma symptoms are severe or persist for more than 3 to 5 days after the initial injury. If your nose looks deformed or has lost its usual shape, you may have a complicated break that needs to be reset by a medical professional. /r/n/r/n Seek immediate medical attention. Call 911, or go to the emergency room if you experience any of the following red flags. /r/n/r/n Blunt force trauma causes about 90% of all broken noses. This can result from the following. /r/n/r/n A 2017 study on the reason for nasal bone fractures ranked the most common causes of a broken nose for adults and children. /r/n/r/n In adults, the most common nasal bone fracture causes are /r/n/r/n In children, the most frequent causes of a broken nose are /r/n/r/n A 2021 study of nasal bone fractures during team sports found that about 1 in 4 broken noses happen while playing basketball, followed by baseball, 17.1%, softball, 9.8%, soccer, 7.4%, and football, 7%. Boxing, mixed martial arts, wrestling, and mountain biking also commonly cause broken noses. /r/n/r/n A broken nose is a common injury, but nasal fractures are more prevalent among certain demographic groups. In general, athletes, assault victims, people prone to falling, and anyone who rides in a vehicle without wearing a seat belt are all at risk of a broken nose. /r/n/r/n A national analysis of risk factors for nasal fractures in the United States found that almost 3 out of 4 people who showed up at the emergency room with a nasal fracture were male, 74.8%, with an average age of 45.6 years. However, it's hard to make generalizations about who's at highest risk of a broken nose based solely on age, sex, or gender. /r/n/r/n Broken noses are diagnosed during a physical examination by a healthcare provider who will ask questions about the injury and mechanism of trauma, i.e., basketball, fist, airbag, etc. In aditio, enter patient history. Nasal trauma evaluation and diagnosis typically assesses /r/n/r/n Anterior rhinoscopy or nasopharyngoscopy may be performed to examine nose cavities and look for signs of a nasal septal hematoma, NSH, deviated septum, or other abnormalities. In severe cases, imaging tests such as Xrays or computed tomography, CT, scans are used to assess the extent of the injury. /r/n/r/n Applying ice or cold packs for 10 to 15 minutes every hour to reduce swelling and alleviate pain is a gold standard first aid regimen when treating a broken nose at home during the first 24 to 48 hours after a nasal fracture. /r/n/r/n When using ice or an alternative like frozen peas, make sure to wrap them in a washcloth or tea towel to prevent frostbite. Never apply ice directly to the skin. Icing for longer than 20 minutes at a time can cause tissue damage. /r/n/r/n The head should stay elevated immediately after a nose injury and while sleeping, but don't tilt your head back during a nosebleed, epistaxis. /r/n/r/n Over-the-counter OTC analgesics can be used for pain relief. When treating a broken nose at home, use Tylenol, acetaminophen, instead of nonsteroidal anti-inflammatory drugs, NSAIDs, like Advil or Motrin, ibuprofen. NSAIDs can increase bleeding within the first 48 hours after a nose injury and may slow a nasal fracture's healing process. /r/n/r/n OTC decongestants and nasal irrigation If you've recently broken your nose, you can keep the nasal passages clear and clean. Also, try breathing through your mouth and avoid blowing your nose. Speak to a healthcare provider before doing strenuous activity after experiencing a nasal fracture. /r/n/r/n To sum up, below are 7 first aid treatments and self-care protocols for a broken nose you can do at home using over-the-counter OTC medications as needed. /r/n/r/n Manual realignment by a healthcare provider is the most common medical treatment for a broken nose. In severe cases, surgical interventions may be necessary. If OTC medications aren't strong enough to alleviate pain, prescription strength pain management techniques can be used. /r/n/r/n Manual realignment, also known as closed reduction, is a non-surgical procedure that resets nasal bones displaced by a traumatic event using a doctor's fingers. This procedure is typically performed by a healthcare provider such as an ear, nose and throat (ENT) specialist, otolaryngologist, within 2 weeks after a nose injury, using local anesthesia. After realignment, a nasal splint is applied to stabilize bones while healing. /r/n/r/n In severe cases, or if manual realignment fails, surgical procedures such as rhinoplasty or corrective septorhinoplasty are performed under local or general anesthesia to fix complex nasal fractures. /r/n/r/n It takes about 6 weeks for a broken nose to heal. Swelling and acute pain should subside after about 3 days. Bruising and tenderness will gradually fade in a week or 2. Using ice packs in the first 48 hours, keeping your head elevated, and avoiding aggravators like blowing your nose or doing strenuous activity will promote healing and help prevent complications. /r/n/r/n Although most broken noses heal on their own, it's important to see a healthcare provider or visit a hospital emergency department if you have a nasal fracture. Getting a broken nose realigned manually within 14 days of the injury is crucial for proper healing. If you wait too long to fix a broken nose, it's less likely to appear the same after healing. /r/n/r/n Avoiding physical altercations can prevent broken noses. Fights are the leading cause of nasal fractures among adults. Not having fist fights significantly lowers the risk of breaking your nose. /r/n/r/n If you're in an abusive relationship that involves physical violence, ending the cycle of abuse makes nasal fractures less likely. The mid-face region is the most common location of facial injury among victims of intimate partner violence. /r/n/r/n The National Domestic Violence Hotline can help men and women seeking a way out of an abusive or violent relationship find local resources. You can also call them at 800-799-SAFE, 7233, or text START to 88788. /r/n/r/n If you play sports, wearing protective face gear during athletic events can significantly reduce broken nose risks. The increased use of full face guards and protective facial shields in recent years has contributed to a notable reduction of nasal fractures among athletes. /r/n/r/n in high-risk environments. Safety precautions such as wearing a seat belt whenever traveling in a vehicle can help prevent broken noses. Not wearing a seat belt in an automobile with airbags increases the risk of nasal fractures. /r/n/r/n broken noses are the most common facial fracture. Because the nose sticks out, it's usually the first part of the face to get hit. Fist fights, car crashes, sports injuries, and bike accidents are some of the most common causes of nasal bone fractures. Pain, swelling, nosebleeds, and crookedness can all be signs you've broken your nose. /r/n/r/n Most broken noses don't require surgery but are realigned by a trained medical professional using their fingers within 2 weeks of the injury. Ice packs are a vital part of first aid for nasal fractures because they reduce inflammation. Over-the-counter pills like Tylenol can help relieve pain, but anti-inflammatories like Advil shouldn't be used in the first 48 hours after breaking your nose. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.